When treating telangiectasia in skin types 2 and 3, sometimes you see the telangiectasia disappearing immediately after passing over it with a 5.32 nanometer laser. You see a darker shade taking the place of the telangiectasia due to the melanin denaturation. No other skin change whatsoever should be seen during treatment. The clinical endpoint is the disappearance of the telangiectasia and sometimes a little erythema that could be left around it. Around the nose, treatment could be more painful, but in any case, it is always tolerable without anesthesia. This is another treatment of facial telangiectasias. At the beginning, the treatment is made in a slow way. You should do so when using this kind of laser for the first time. It's perfectly tolerable, and you can see that it is necessary to use only medium power of the machine. If you slow down, the patient feels absolutely no pain. Sometimes, according to patient's tolerability, you can speed up the treatment. You can either start from smaller or bigger vessels, it makes absolutely no difference. The endpoint is to see telangiectasias disappear without any skin changes. There should be no change in its color. Another advantage is that if you see hyperpigmentations around the area, you can treat them without changing any setting of the machine and they become darker. Another advantage is that if we see hyperpigmentation around the area, without changing the settings of the laser, we can treat them, paint them over, and make look darker before the treatment. Telangiectasia can be treated around the whole face without changing the settings. Of course, getting closer to the nose means more painful treatment. You should always keep the laser at a 90-degree angle towards the skin. This is the right way to hold it, perpendicular to the skin. Hyperpigmentation becomes darker, and you can go on treating another part of the face. Telangiectasia disappears. You actually bring the blood to a boiling point without damaging the surrounding skin. The skin is left intact, which means that patients can use makeup immediately after the treatment if they want to. When treating hemangiomas, we divide the treatment into two stages. The first stage is the photocoagulation. It should be done in a very soft way in order to avoid the need for anesthesia. If you treat it slowly in the first few seconds, you can then work much faster because the lesion is no longer sensitive. From coagulation, you go into ablative phase, because you can make the whole lesion disappear immediately. The laser is a vascular laser and has a good coagulative action. The whole treatment is performed in perfect hemostasis. At this stage, you can work very fast in a quasi-continuous way, and you can see immediate results. Sometimes we can combine this treatment with a skin cooling system in order to reduce pain. It is left up to the patient to decide whether to prefer this additional treatment. It is very important to choose the right spot size that must be decided case by case in order to avoid burning, skin damage, and/or bleeding. Treating senile stains on dorsum of hands is very subtle. You have to treat the whole lesion either with a scanner or a 0.5 or 1.2 mm spot. You don't need the whole power of the machine. It depends on the speed of your movements. According to it, you use a much lower setting, thus diminishing the pain sensation for the patient. All treated lesions are much darker than the untreated ones. The pain should always be tolerable. If the patient reports an intolerable pain, it means that your settings are too high for that case and you should lower them. You shouldn't be worried by smoke because it comes from burning the hair shaft and has no consequences. As soon as you get more experience, the work can be speeded up. You can work in this way, and if you are fast enough, you will avoid any kind of necrosis. Smoke may come from burning hair shafts. You should not indulge in resting on one lesion, otherwise you obtain, instead of a darkening of the stain, a decoloration of the skin, which means necrosis, and the after-treatment evolution will be much longer. You can make the treatment in one session, and you can reach up to 80–85% clearing of the area. In any other treatment, you would have less efficiency and sometimes more pain. I remind you that at the end, the skin is perfectly intact. The stains are darker and will shade off in about 2 weeks. Treating dermatofibromas is quite easy. The first stage is to make them turn darker and gray. The next stage is the ablative phase. You can speed up the treatment without any kind of anesthesia because the first stage, when the lesion turns into gray, is perfectly tolerable, and you start ablation only after the necrosis, when the feeling is not there anymore. The slow ablation goes on, and it's obviously more aggressive than in other cases. However, as you will see, without changing a lot, you can go on into continuous wave mode. You can also treat the same lesions with a scanner. The selectivity of this wavelength is going to have no consequences to normochromic skin, and it is going to turn the stains into a darker color that will eventually shade off after 2 weeks. You should not overlap your pulses because this may cause burns.